Hello and welcome to Single Pair Radio. I'm Paul Hoppy, broadcasting from the Habron Building in Louisville on the WFMP 106.5 Forward Radio Community Network. Our programs air every Monday at 2 p.m., Tuesday at 7 a.m., and Wednesday at 11 a.m. And we also stream our show on SoundCloud. The show is a project of Kentuckians for Single Payer Healthcare in conjunction with Physicians for a National Health Program through its Kentucky chapter. We produce this program because we believe healthcare is a human right. We advocate for a national, not-for-profit, publicly funded, single-payer healthcare system that works for everyone. The views and opinions expressed on our show are those of the speakers and not the station. Our station relies on volunteers like myself and your ideas and donations to keep us on the air. And now I'll turn it over to Kentuckians for Single Payer Healthcare Chairperson, Kay Tillow, to get the discussion started.
I'm here with four other participants from Kentuckians for Single Payer Healthcare, and we're going to talk about the recent outrage and opinions expressed in the wake of the killing of the United Healthcare CEO, Brian Thompson, which happened on December 4. And we're going to discuss several different articles and what that means for our country and what's going on in healthcare and what should happen from here on. So first, I'm going to introduce Jill Harmer, who will begin the discussion with an article by Michael Moore.
Michael Moore he produced Sicko in 2007, and I'm a fan of Michael Moore. That was a great movie, netting $25 million, and he is offering it free to anyone because he sees this as the time that we can actually do something about the situation. It's just not merely retaliation for so many people that are killed by health insurance denials of care, but we can do something about it now, and you will be hearing more about that after I tell you more about Michael Moore's article. We are apologizing for the violence that we needed the violence to get this across to us. But America's entire history is defined by political violence. We slaughtered the indigenous people who already lived here. We enslaved African people that our founding fathers kidnapped and brought here. And we forced women in our country, according to Michael Moore, to give birth against their will. And Americans just voted in November to approve Trump to mobilize the U.S. military to round up and forcibly remove immigrants. And our country was founded by immigrants. So we've also spent the last 20 years bombing and slaughtering people in the Middle East. And we're spending billions and billions of dollars right now to bomb and kill and starve and exterminate women and children in Gaza. So violence is customary for us, but I would like us to stop that. Michael Moore he produced Sicko, and I highly recommend it, even though it's almost 2 hours. And when he produced Sicko in 2007, he said that the USA was 37th out of 199 countries. And now it's more like 67th or even lower than that. And life expectancy now in the United States is the 55th country. And Moore is straightforward in his movie as he is in the article about a manifesto against for-profit health insurance companies. Michael Moore says, I condemn murder, and that's why I condemn America's broken, bloodthirsty, unethical, immoral healthcare industry. And I condemn every one of those CEOs who are in charge of it. And I condemn every politician who takes their money and keeps the system going instead of tearing it up, ripping it apart, and throwing it all away. We need to replace this system with something sane, something caring and loving, and something that keeps people alive. And we have it in Congress right now. We're tired of insurance companies denying our claims and bankrupting us with deductibles and co-pays, and then giving us the runaround and long waits. Well, I'm sorry that we needed violence to get attention on our failing healthcare system, but now is a moment of motivation to create the healthcare system we deserve and other countries all over the world have. The American public holds immense power because the numbers don't lie. There are only 800 billionaires in this country and 6 million millionaires, but there's 160 million of us. And so we gotta show them our power, give us the same healthcare that every other civilized country on earth has. And the solution is in Congress right now: universal, free, and compassionate haircut. Michael Moore is offering sicko free, and you can either Google it, or I will say right now that it's youtube.com/watch V as and valiant and =, YB, EQ7, ACB in lower letters, then 01 E. I know you all got that, but Google it. He's giving it away free. Thank you. Jill Harmer.
Thank you, Jill, for that passionate review of what Michael Moore had to say. Do any of our other members have comments on this? Paul?
Well, I have to agree with Jill completely on her admiration of Michael Moore's film Sicko. I think it's the preeminent video produced to show to the public how bad our healthcare system is, and also to let us know how good it could be. He does that through numerous interviews with people in other countries concerning their healthcare system. One other thing I want to correct is when Jill started, she said that Michael Moore is giving it away free after mentioning the $25 million that it produced. He's not giving away $25 million.
You know what I like best about the movie is, well, I mean, it was most impactful. I can't say I liked it, but in the 9/11, you know, fire workers that helped, and then they got diseases, lung diseases, and problems from having done that. The United States was not helping them at all. Michael Moore showed in the movie that the fire workers went to Cuba and got help there for something that I mean, we all need good health care, but my word, the firemen that helped on 9/11 deserved it even more.
And if you were unable to get that link to see Sicko, you could go to kyhealthcare.org. That's our website, and we'll post a link up there so you'll be able to find it. And you can also get in touch with us through that website. Our contact information is there. We'd like to know if you want us to show the film, we could bring it to Louisville and show it in the library or a Union Hall or a church basement or somewhere where people could come out and see it. So we'd like to hear from you if you'd like to have us show the film. Charlie.
Now, the other interesting thing, Jill, on your presentation, like Michael Moore made sicko in 2007. We were talking a little bit before the show that uh, that is a long time ago, and
Yeah,
things have gotten absolutely worse since then.
yes.
The insurance companies are making so much more money than they ever thought they had, and our healthcare system and the various things that are gauging how good it is have gone downhill since. And here
Right.
we are still arguing over this, and nothing has been done. I think that's a disgrace.
Yes.
Yeah. What was passed was the Affordable Care Act in 2010. And clearly, it was not a plan that solved the problem, as we can see now from the outrage over the denials of care and the problems and difficulties that people are having paying for health care and actually getting access to health care. Okay, shall we move on to the next person? Who would like to go next? Paul.
Yeah, I have an article that I've been reading. The title is Public Quality Healthcare Possible in the United States, and it was written by Natalia Marquez, and it's basically geared toward, as a lot of media today, towards the assassination of Brian Thompson with United Healthcare. So, like a lot of these articles, they kind of focus on the misgivings of United Healthcare. One thing, before we start, I'd like to note that United Healthcare is a private equity company that's huge. It goes way beyond health insurance. They totally have a monopoly on in many ways on our healthcare system. They're the very largest. I believe they're the fourth largest publicly held corporation in the country. But they have built what's referred to as a vertically integrated health system, which means that they own everything that's involved from the top down to the very point of paying physicians and hospitals for services rendered. They own the pharmaceutical benefit manager portion of it. They own the healthcare insurance portion of it. They even, when they go to buy out physicians' private practices, of which now today in this country, 77%, I think, of all physicians work for a private equity healthcare group, which is just astounding. So, in terms of when they go around to try to buy out these physicians' healthcare groups, they tend to, like most private equity, they tend to kind of let the group founder, and then they sell them off to another company, and it just goes on and on. They do the same thing with hospitals, private equity does. So it's more than just railing against the healthcare insurance. It's railing against private equity in our healthcare, and that's what our group strives for, is to get private equity out of our healthcare and make it a publicly financed system in total. That's why we refer to it as Medicare for all. And I like to tell people that, we wait till we're 65 and we're so proud to get our Medicare cards. And we'd like to turn that around and have you get that when you're born, not when you turn 65. But so I digress, I guess. But the fact that they produce these horrendous profits that should be going to take care of us and our doctors and hospitals is just it's bad enough, but it seems like their business model is built on denying claims to increase profits. So we have a slogan we use all the time about healthcare today. It's profit over patients, and that's really what this country needs to turn around, make it the other way. But this article just kind of goes over the way the events have shaped the mood toward healthcare in this country. It's awakened so many people and made people aware of the ills. And our group has been doing this for over 20 years, I guess. And I recognize that the shooting, the murder of a single person, has done more to sway public opinion toward what's going on with our healthcare system than all the groups like ours have done in the last 20 years. It's kind of amazing. So we see that as a great opportunity to step up or are advocating for a healthcare system that works for everybody and it's publicly funded. But as we can imagine, the lobby interest of the healthcare, just the healthcare insurance companies, is so formidable. It's a daunting task. We don't get very far with legislation, and it pretty much sums up the fact that it's up to us as individuals to fight for our healthcare system and our healthcare. It's people who have insurance can't afford to utilize the insurance. They have the co-pays, the co-insurance, the deductibles, and then on top of all that is the denial of service. And it seems like maybe that was the focus of Mr. Mangione's anger towards the healthcare system. But certainly now we can appreciate how he was feeling. So I guess to sum up, I have lots of data that I read in this article that goes back to how this situation got started, but we're going to hear more about that today. So I think that's really all I have about the article. Thank you.
Thank you, Paul. That was very helpful. And you're absolutely right about the profits being the problem, and that when those who profit from denying you care, when their job as an insurance company is to provide the care, something is really, really wrong. And I think that explains the outpouring of rage in the aftermath of the United Healthcare shooting. The United Healthcare really has, I think we've learned that they have something like 32% denial rate, and which is higher than even the other companies. So people are absolutely furious that they and their loved ones are unable to get the care, and that poured out in the aftermath of that violent shooting.
I heard from a physician who is actually third generation, I think, that in the 1980s, early 1980s, he hypothesized that maybe there were 1 million denials of care by the insurance at that time in the whole country for the year. Today, we actually see millions of denials of care in 1 year, many millions.
Mm-hmm.
It's astounding.
It's true. And we see that because we have a profit-making middleman in the insurance company or the HMO in between our physicians and our patients. And those people are making the decisions about the denials. And that's what's wrong with the system. The system doesn't work to allow a profit maker into the mix to deny what the professional caregiver would say is the proper treatment. And it's wrong. It's wrong to turn a public service into a profit-making business, to walk away with the billions when people can't get care. Anyone else on this topic? Okay, who would like to go next?
I'll give it a whirl. Can
Okay,
you hear me?
this is
Yeah.
Dr. Garrett Adams.
Yeah. Hi, everybody. I'm recently retired pediatric infectious disease specialist, full-time from the University of Louisville. Not really recently retired from that, but you're right about the dates, the early times when Sicko came out in 2007. And I remember, I believe it was perhaps 2006. I read an article in the Journal of the American Medical Association called about national health care. And after reading this article, I thought it made perfect sense that we would have national health care. And so I joined the Physicians for National Health Care. And at that time, there were about 8,000 nationwide. Today, there are more than 20,000 physicians, but we'd like to see that grow. We have an annual meeting every year, and it is growing. It's the best organization as far as physicians for trying to change our health system in this country. And this event, this horrific event, is something that we have to take into consideration. It's going to take us a while to really consolidate our feelings and our thoughts about it. But I think that the best way is to double down and work harder on getting the health care that we need. And we have to do this through the political mechanism that exists in this country. And I'm really proud of the current leadership of the Physicians for a National Health Program. They have a especially important campaign against so-called Medicare Advantage, which has been more of a disadvantage. And the United Healthcare is the largest provider of Medicare Advantage plans in the United States. And so this is one area that we have a campaign now, and an announced campaign from the Physicians for Our National Health Program against Medicare Advantage. Other goals are to build relationships with local and national legislators. That's a must. We have to establish stronger footholds with our medical society. I had an interesting letter from a colleague who's never spoken to me before about my interest in single-payer national health. But he wrote this letter. He sent me a clipping of Wendell Potter's New York Times recent opinion. And Wendell Potter was what's the word when an employee tells the real truth about what's going on? I can't think of the word.
He's a whistleblower?
Whistleblower. Thank you so much. I've been looking for that word for a few days. but Wendell was and is still a whistleblower. He's a wonderful man. And I recommend his book, highly recommend. The book is Deadly Spin. And he was there, and he tells a story about a young woman when he was at Cigna, and he was in charge of publicity and so on. And there was a young woman who had liver cancer, and at the last minute, his insurance company denied her care. And this is not the first. There were many along the way that have had care denied. Kay and I got to know a family where there was the leader, the father in the family was a successful owner of an automotive business. He had cancer and he was treated and he recovered. And then his cancer came back, but he was already in over his head in debt. And poor fellow went out in the backyard and took his own life. He didn't take somebody else's life, took his own life because he couldn't bring the debt to his family. And his wife permitted us to publicize his story, and she actually came to a street meeting that we held at one point back in the earlier part of this decade, these 2 decades. There were others that I had made note of. Linda Pino was an employee. She's a physician. I knew her when she was a medical student, and she worked for Humana, but she approved an expensive, she was responsible for reviewing applications for insurance as an employee of Humana, and she approved an expensive heart procedure for a man that needed it, and that as a result of that, she was fired from Humana, but she stood up and she actually made her case before the U.S. Congress. I knew a young woman who had leukemia, and she was at MD Anderson Hospital, ready to have this advanced treatment, and the insurance was withdrawn, and she died before she could receive the treatment. So how long are we being the American public, going to put up with this? And what can we do differently from what has been done before? So I think we have to work with what we've got, but the work is the actionable word in that sentence. And I do want to make a point that it's frightening to know that the apparent assailant in this murder was using a ghost gun that made from a 3D printer.
Oh,
And there are thousands of these guns out now. See, I had something on that. But we have an epidemic of gun violence, and there are, I know what it was. It was tens of thousands of these ghost guns, tens of thousands of ghost guns are recovered from scenes of violent crimes all across the country. This apparent alleged assailant had. And I've become aware of, and most of you have, hopefully, of the epidemic of gun violence. It's the largest, most common cause of death in children in this country. So this is just another aspect of this past experience. But I do want to say in closing what some of the P&H Physicians for a National Health Program plans are. Number one would be a campaign against so-called Medicare Advantage, an attempt to build a relationship with local and national legislators, establish stronger footholds in our medical societies. The Jefferson County Medical Society has been lukewarm, cold, actually, with regard to any support of single payer. And to engage thousands of physicians to understand moral injury. And what is moral injury? It's a failing to consistently meet a patient's needs. It has a profound effect on the physician's well-being. This is the crux of what they're calling moral injury. It's a cousin of burnout. So the last point would be that the PNHP has joined forces with Robert Wood Johnson Foundation to conduct nationwide survey of physicians regarding financialization of healthcare and the harms and inequities that profit-driven middlemen impose on our patients. That's all. Thank you.
Thank you very much. That was Dr. Garrett Adams. He worked for decades in Louisville as a pediatrician and took care of many thousands of our children. And he founded Physicians for a National Health Program, Kentucky, which we are affiliated with as Kentuckians for single payer healthcare. So thank you, Garrett. And next is Charles Casper.
Thank you, Kay. Yes, I'm Charlie Casper. I've been on the ASPH steering committee for a number of years, and I wanted to share briefly an article from a group called Portside. Goes into issues of national prominence, and certainly since the CEO murder of the United Healthcare director has made plenty of news. They wanted to summarize a few items that are very interesting. The title of the article is "Americans Hate Their Private Health Insurance." And the interesting thing about that is many years ago when Bernie Sanders was very involved in single payer and Medicare for all, the drumming he got from health care executives was that Americans love their health insurance. And that was a garbage, as we find out and are finding out right now with this CEO's murder. And it surely disproves the claim that Americans love their private health policy. A lot of it is something out of their control to begin with because it's employer based. But the private healthcare system is a political force. It's just waiting to be harnessed. But few people in Washington, D.C. seem to care. They are just oblivious to what's going on. The bottom line is, according to this article, Americans are simply not happy with their U.S. policy, healthcare companies. And for the first time in a long time, Americans rate their U.S. healthcare as substandard, including a very high number of the Gallup poll saying it is extremely poor. And that is, we're seeing what's going on now with the social media and people posting things on social media about what happened with their insurance and how they can't stand U.S. health insurance companies. Many, of course, have gone to the point of deriding the death of this man. And that's obviously something that we can't tolerate. But there's also an understanding of how they feel about their healthcare insurance. But it's not just the public that's flooding the airways. It's healthcare workers, people that are doctors and nurses who treat these patients. They're going online and talking about how we have such an inferior healthcare system, and something's got to change. It's total disgust with the for-profit healthcare companies, and it's really rearing its head right now, a big time. And I think we're beginning to see that. And the the healthcare lobby is filling the pockets of people in Congress, and you'd have to be crazy not to believe that that's influencing what they think about healthcare companies. And the sad part about it is we're seeing the results of that right now, and something's got to be done. According to this article, the fact that the U.S. public response to the murder of this man speaks volumes about Americans' widespread disgust with the private healthcare system. And it leaves so many destitute or simply dead. And that's what we're facing right now. So something's got to be done. And I think this is an opportunity to bring to light people's very real concerns and disgust with where we are in our healthcare system now. Medicare for all is the only way to go. Thank you.
Right, Charlie. Oh, that's a really important point, because there's been a claim by, many of these think tanks on health policy that you can't change to a single payer, publicly funded system because people love the health insurance that they have. And clearly what came through in the aftermath of this shooting is that that is not true, that we have a clear majority that are ready to get rid of the private health insurance industry and to go to something that would better serve them. Any other comments on this piece?
I would just like you to put on the website how to sign the petition. It's on PNHP against Medicare Advantage.
Okay, Jill, I'll put that up on the website. You can go to kyhealthcare.org and find out lots of information, how to contact us. You can attend our meetings, and you can find the information that Jill is speaking about. Okay, Paul.
Before I forget, referring back to Dr. Adams' comments about gun violence and gun deaths in this country, we have an upcoming program on that. We've done several in the past, and we've got another one on gun violence with from juveniles and what drives them to turn to things like that. So we're going to have Dr. Steve Lipman on there to talk about it. He's a psychiatrist, and look for that in the next month or so, if you're interested.
Good deal. Thank you, Paul. Okay, I have the last article we're going to discuss on this topic about the shooting of the United Healthcare CEO. The article that I read is by Sonali Kolhatkar, and she is a journalist, and she has a program on Pacifica Radio called Rising Up with Sonali. And she wrote in LA Progressive under, "Is there a collective solution to health injustice?" And she wrote, "The fight over healthcare in the US is about competing narratives, profit-making versus collective well-being. We need to articulate a publicly funded solution now before corporate spin silences." And her point is that in the wake of this shooting, that before the industry could spread the spin on what it was about, and before the pundits could spread their spin, that people got into social media and began to talk about what United Healthcare was doing to patients in this country. And that became another narrative that became so loud and strong that it overwhelmed the culture before anything else could be said by the industry. So there's that narrative of the industry that says, well, this is the best you can get. And we had Whitty, who's the CEO of Healthcare Group, who said, all we need is just a little more transparency and everything will be fine. Well, that's a different narrative. The other narrative that was highlighted in there is the narrative of the shooter who was demonstrating that he felt armed violence was the way to solve the problem. So Sonali Kathatyar asked the question, is it possible that the story that can come through and that the narrative can be that we will collectively embrace a systemic solution to the crisis and what that looks like? Can we move to a publicly funded healthcare with a complete dismantling of the insurance industry? And she says it's long time for us to do that because other nations have been able to do that many decades ago, even a century ago. And that the horror stories that have been unleashed by this incident, while they are still hot and going around and people are coming to a more thorough and deep understanding, we need to rewrite the narrative and recast healthcare as a human right, a necessity akin to public education, not a profit-making opportunity for Brian Thompson or Whitty or other health insurance stakeholders. So that's her challenge to us. Can we unite around not just our common hatred of a system that preys on us, but on the system that will solve the crisis, a publicly funded national system?
Yeah, that's great.
You like that, huh? She's something.
Yeah.
Okay, we're open for discussion.
I just want people to know the difference between insurance, health insurance, and healthcare. I mean, we want healthcare, and we don't need insurance companies to get it. We need Medicare for everybody.
Right. And we have to enact national legislation in order to do that. I mean, there's no other way that we're going to do it. And I think there's kind of a battle, you know. There are those who say, well, we just need to tweak the system and put a few patches on it and it'll be okay. And that really isn't true. We now spend double per capita what other wealthy countries spend, and our outcomes are worse. Our life expectancy is, I think, 55th in the world, which is terrible. It's a disgrace with a wealthy country that has wonderful physicians and technology and the great wealth and great ability to have a very fine healthcare system that takes care of all of us. For us, it's a disgrace for the nation that here we are with failing outcomes in our system at the bottom of the heap in terms of comparable countries.
Well, and it really is frustrating too when we talk about, you know, the people, as that article I referred to said, it's the politicians that don't seem to want to do anything. And, you know, part of that, as we talked about, is the healthcare lobby. It's throwing a lot of money their way. But I wonder sometimes if maybe, you know, they realize that they would be, if it went to a Medicare for all, they'd be under the same system rather than their blue ribbon insurance that they have. And I don't know how you combat that. They're in power. They can do what they want to do. And it's frustrating. Somehow the people have got to stand up and have their voices heard.
When
Yeah,
people,
I've struggled with that, Charlie, and what one thought is that we change the people that are making those decisions.
Yeah.
That's why, you know, politics are important, and the people that are making those decisions are important.
Yeah. 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 You're exactly right. And unfortunately, takes time.
And Jill?
I get a lot of people saying, well, that's just impossible. We can't do it. We don't have the money. We don't have the clout. But when I think of working for no to an amendment that would prohibit gay marriage, and that has come such a long way. I never thought that would happen. So if that can do it, I'm hoping we can do it too, because we're affecting everybody by what we do.
You know, I think that the anger that was expressed, real rage in the aftermath of this shooting, relates to a frustration that neither of the political parties are pushing the kind of solution that would solve it. I think that is the difficulty, is that people are not seeing the democratic process resulting in the depth of a solution that we need to just get health care for all of our people. And what I'm hoping is that the rage that has come out around this can, you know, kind of the steam can be used to propel the engine of a stronger push politically to make something happen in the Congress and to force the enactment, to make the people power and the feelings and the votes and the necessities of the people have more weight than that of the insurance industry.
I agree, Kay, and I think that you know, we are a non-political organization, but we are about to transition into a new administration, and I think things are going to be going opposite to our direction, and then for the next 4 years, and that's only going to foment more anger with things as they exist in this country. So that may be kind of the silver lining to keep up this dissatisfaction with our government and not working for the people instead of working for Wall Street and big corporations and the wealthy in this country. It's about the least I can say and the most optimistic I can be about what's ahead.
Well, the system that we in Kentuckians for single payer healthcare advocate is the one that's spelled out by the Physicians for a National Health Program. And it's a national single payer system that removes the insurance industry and thereby uses the money saved that's spent unnecessarily for profit and administration and puts that money to use for care, to improve the system for all of us. So all of us have better care with dental and eyeglasses and long-term care and mental health and no payment at the point of service. And that's an improved Medicare for all, a free from profit national single payer healthcare system. And we invite everybody to join with us in advocating for that and in getting that passed through the Congress that has to succumb to the will of the people.
I'm also fond of tying into other social injustices in our cause, which we can trace back the history of our healthcare system starting to go and get the way it is now back to the 80s, late 70s, early 80s, when there was monumental change in this country in terms of wealth transfer. It started moving upward at that time, and it just kept growing and growing every year. And now we're at the greatest time of inequity that we've ever seen in the history of this country. And so we talked about Michael Moore's epic film, Sicko, but there's another one that I like just as well. And that's a film that was released in 2013 by Robert Reich, titled Inequality for All. That's a video that everybody ought to watch also. It helps explain how we got where we are today.
And certainly the economics of the situation are the problem. I mean, people are going without care because of the cost, even when they have insurance. And that's one of the things that changed with the passage of the Affordable Care Act was, yes, we got some more people covered, but the people who have insurance, many are unable to afford their care. The deductibles and the co-payments and the narrow networks are all barriers to people being able to get the care that they need. And that's what we have to remove. There shouldn't be anything in the way of going to a physician and getting taken care of. It's just a human dignity, decency, and we need healthcare, like we need education, and we need the post office, and we need the fire department, and we need all of these things. We need water available, and all of those things should just be available to all of us if we're to live in a society with some dignity and decency and democracy and civility. We don't want to fight it out in the streets with guns, right? Hey, Jill.
I also remember what Garrett Adams said about moral injury. And when you think that a physician takes all those courses and spends all that time because they really want to help people, they want to make them get better, and then the insurance company takes their time away and just really hurts them deeply. And I think a lot of people don't even think of it from the physician's point of view.
Yeah, the PNHP has created a questionnaire to distribute to physicians to try to get a better handle on that. But I understand it, and you can think about it. I mean, their hands are tied. They can't. It just. I think about Wendell Potter, for example. I know he's glad he got out of the industry, but and some doctors do that. They get out of it.
Garrett, a lot of doctors today, since I alluded to the fact that 78% of them work for somebody else now, a large corporation usually, that they have to actually watch what they say. They can't really be too outspoken about the system for fear of retaliation by their employers.
And it's terrible for physicians to have to be working for and responsible to an insurance industry that wants to gain from their work and has an interest in incentivizing them to give less care. That's a huge, huge contradiction within our healthcare system. And that's why we're losing good physicians. They're retiring early. They're under great stress, and they have so much to put into the medical records, and most of that has to do with billing. So they have little time to be able to actually deal with patients and diagnoses and the things that they have the professional expertise to handle. They spend hours and hours on the phone trying to get approval from the insurance company for the treatment that they believe has to be done for their patient. So we have to get the insurance industry out of our healthcare so that we can get the caring and we can relieve the physicians of the burden of having to pay homage to the money men in the healthcare system.
I'm open to suggestions of how we can recruit more doctors. For example, this doctor that I mentioned had sent me a copy of Wendell Potter's New York Times. I didn't know that he had any interest until he did this, and but how can we generate some buy-in from our local physicians, for example? I think we start here. That's what we have.
Unfortunately, Garrett, as Paul said, most of them are working for corporations that are totally oblivious to that, and that's the sad part.
But we do have a number of physicians who are involved in our organization, and many, many thousands nationally. And really, they are at the heart of this fight for a national single-payer healthcare system. I know many of them are organizing into unions. That just happened with the physicians who work in Minnesota for Alina. And that's one way that they are fighting back. But we would invite any physicians who are listening to this to get in touch with us through our website, kyhealthcare.org. And we'd be glad to hear your story and to work with you in ways that we can help you to improve the conditions under which you practice your profession. So we thank you for listening to Single Payer Radio with Kentuckians for Single Payer Healthcare. Our shows air 3 times a week, and we invite you to come in on the radio show at forwardradio.org, and we invite you to get involved with Kentuckians for Single Payer Healthcare. We believe that working together, we can make a better healthcare system, a national improved Medicare for all, publicly funded, everybody in, nobody out system work for the nation. Thank you for listening.
And this ends another episode of Single Payer Radio. Please join us again and have a great rest of your day.